Assalamu alaikum everyone. In this lecture we will discuss an important topic in CNS medicine, which is hemorrhagic stroke. We have discussed ischemic stroke in previous lectures. Okay, in this lecture we will cover all important points of hemorrhagic stroke regarding MCQ and SCQ. Okay, in exam and clinical practice learning objectives are: what is hemorrhagic stroke? Okay, what are the causes of hemorrhagic stroke, what are types of hemorrhagic stroke, okay, and what are complications. Similarly, we will discuss about how will we investigate a patient which is suspected of hemorrhagic stroke. Similarly, how will manage a case of hemorrhagic stroke. Okay, so let's start the lecture. First of all, we will understand what is stroke. Okay, stroke is a condition in which blood supply of brain matter is compromised. Okay, compromised. How it will compromise? It will compromise via two conditions or two main causes. Okay, first one is through emboli or thrombus. Thrombus, okay, which cause ischemic stroke. Okay, ischemic stroke. And another condition is hemorrhage. Okay, how hemorrhage cause stroke? Hemorrhage cause stroke by compression. Okay, compression. Okay, these are main two types of stroke. Okay, now brain will cease its function. Okay, brain will cease its functions when there is deprivation of blood supply or oxygen supply, okay, greater than 90 seconds. Okay, function will be ceased after 60 to 90 seconds approximately. Okay, and approximately after 3 hours, okay, there will be irreversible injury. Okay, so before 3 hours the blood supply should be established. Okay, otherwise there will be irreversible injury. Okay, in hemorrhagic stroke there is formation of hematoma. Okay, hematoma cause compression. Okay, compression brain matter. Okay, brain matter which cause ischemia. Okay, secondary ischemia. Okay, it is direct toxic effect of blood. Okay, direct toxic effect of blood. When blood is leaked in brain matter, okay, there is toxic effect of blood. Okay, which cause inflammation, and inflammation cause secondary injury. Okay, this is another condition. Okay, the causes of hemorrhagic stroke are hypertension. Okay, aneurysm, mainly Berry aneurysm. Okay, which is form for aneurysm at circle of Willis. Okay, similarly another risk factor or causes are previous ischemic stroke. Okay, which is also a risk factor for hemorrhagic stroke. Okay, and some drugs, for example cocaine and amphetamines are risk factors for hemorrhagic stroke. Okay, hemorrhagic stroke is divided into two main types. One type is intracellular hemorrhage. Okay, and another is subarachnoid hemorrhage. We further divide intracellular hemorrhage into two types. Okay, first one is the hemorrhage into brain matter. Okay, and second type is intraventricular hemorrhage. Okay, now in subarachnoid hemorrhage there is bleeding in between arachnoid and pia mater. Okay, pia mater. This will cause a lemon shaped hyperdense area. Okay, in CT scan of cranium. Okay, now we will discuss about sign and symptoms of hemorrhagic stroke. Okay, the sign and symptoms are severe headache. Okay, patient presented with severe headache, severe with fits, vomiting, okay, and loss of consciousness. Loss of consciousness. Why there is fits, vomiting, and loss of consciousness? These are due to raised intracranial pressure. Okay, these are signs of raised intracranial pressure. Okay, similarly there are signs of weakness. Okay, weakness are hemiplagia. Okay, pericranial hemorrhage and cerebral venous thrombi. Okay, condition mostly associated with headache. Okay, now the sign of hemiplagia due to pressure effect. Okay, we can remember the hemiplagia where mnemonic now, which is fast mnemonic. Okay, for facial drop, A for arm weakness, okay, S for speech difficulty, and T for time to call emergency. Okay, emergency. Okay, so these are the signs and symptoms of hemorrhagic stroke. Okay, now we will discuss about investigations. Okay, investigations of hemorrhagic stroke. Investigations. First of all, we should do CT scan. Why we do CT scan? To rule out the cause. Okay, we should to rule out either it is hemorrhagic stroke or ischemic stroke. Okay, so we will do CT scan. In CT scan, we can appreciate there will be hyperdense area. Okay, in brain matter. Okay, then we can also do MRI. Okay, angiography. So these are investigations of hemorrhagic stroke. Okay, now we will discuss about management. Okay, management. First of all, we will maintain airway. Okay, airway maintenance is the first step. You should avoid the patient from hyperthermia. Okay, avoid hyperthermia. Okay, and we at the head of patient. Okay, head elevation. Now we will reverse the coagulopathy. The cause is coagulopathy. Okay, we will give vitamin K, fresh frozen plasma. Okay, and our target INR should be less than 1.4. Okay, and target platelets should be greater than 1 lakh. Okay, we will give platelet transfusion. Okay, platelet transfusion. Okay, and we will also give desmopressin. Okay, we will control blood pressure of patient. Okay, if the cause is hypertension, then we will control the blood pressure. Okay, and we will give anti-seizure prophylaxis. Okay, and we will do decompression craniotomy. Okay, for large hematoma with clinical deterioration. Okay, we will do decompression craniotomy. Okay, for blood pressure we will usually give nimodipine. Okay, nimodipine. So this is all about hemorrhagic stroke. Okay, if you have any question, any query, you can ask me to. Okay, so thanks for watching.